I'm Dr. Shelley, the Professor of Neurology and Head of the Department of Neurology at Tenapoya Medical College at Darlakate. My brief lines of talk will be centered on the idiom, separating the pearls from the oysters. That is, what are the unique lessons or perspectives that I have learned or observed over my 2 to 3 years decade as a neurologist working in 3 continents on the occasion of World Stroke Day. Now, World Stroke Organization has observed the 29th of October as World Stroke Day sometime in 2006, and it was declared as a public health emergency by the World Stroke Organization in 2010. And I have also had the unique experience of participating in the 10th World Stroke Congress held at Hyderabad in 2016. So let me start by emphasizing first that stroke is a human tragedy. Now, why do I say that? Because stroke is a cause of permanent neurological disability. There is a silent epidemic or a hidden epidemic sweeping across India as far as permanent neurological disability is concerned. And there are mainly 3 disorders that research has pointed out. One is stroke, second one is dementia, and the third one is traumatic brain injury. Now let's look into the magnitude of the problem of stroke. There are about 80 million people who have stroke in the world, out of which 50 million people who are survivors have permanent stroke disability. There is 1 death every 6 seconds in the world, and India is estimated to have 1.8 million strokes per year. Now let me see whether the stroke in India and low and middle income countries are different from the so-called affluent West. Now India has a double burden. That is, it has got communicable disorders as well as non-communicable disorders. When you talk about communicable disorders that give rise to stroke in India, would be simple things as malaria affecting the brain, various encephalitis, dengue, HIV infection, meningovascular syphilis, toxoplasma, parasites like Taenia solium, what we call it as neurocysticercosis, and scrub typhus, which are rickettsial disorders. These all give rise to infectious causes of stroke. If you look at the ladies who are in the postpartum period after pregnancy, infection is quite common in the postpartum period, and we have a condition called postpartum puerperal sepsis, which gives rise to what we call it as the cerebral venous thrombosis, which is again another major cause of stroke in people who have just delivered. So these will be the impact of communicable disorders and stroke as far as India, which is minimal in the affluent West. Now let us turn into the so-called Western disease lifestyles, which we call it as the non-communicable disorders. I would say that the deadly trio which are responsible for stroke in India is nothing but diabetes mellitus, obesity, and physical inactivity. India is supposed to be the world capital of diabetes and obesity, which we call it as diabesity. It is also important to know that air pollution and lack of available clean air for brain and brain health is also said to be a cause of stroke in 30% of cases and dementia in 40% of cases. Let us also look into the peculiarities of India. India's age structure and population pyramid, if you were to look, we have a young population pyramid. The young population pyramid, as far as India is concerned, ages between 15 and 34, they constitute about 35 to 40% of the population. So we've got a very young population here in India. Now, as far as stroke is concerned, it's a myth, I would say, that stroke occurs only in the geriatric age group. Here in India and world across, we find a peculiarity of stroke that is occurring in the young, and we call them as stroke in the young. And if India is going to have such a young population pyramid with a lot of communicable and non-communicable disorders, we can see the translation of that into the magnitude of stroke in these young people. Now, another peculiarity in India compared to the West is 75% of the Indian population are in the rural. About 30% of people are below poverty line. According to the Rangarajan report, in the rural, people can spend only rupees 32 per day, whereas in the urban, rupees 47 per day. So the question here would be, when you have a population asymmetry, that is about 75 rural and 30 are below poverty line, and we try to fight stroke by the organization of stroke units, expensive neuro-interventional actions, expensive drugs which we call it as clot busters to re-establish blood flow, how many of it would translate to a solution for a problem in India with a mammoth population as well as low and middle income countries? That's a question that I would like to ask. I would also like to say that stroke is a lifestyle disorder. If you look at the Harvard evolutionary biologist Daniel Lieberman, he has said that the Stone Age Paleolithic human body across evolution has done wonders, but it is not able to cope with the 21st century lifestyle, the kind of insults that we impose on the Paleolithic body, which is not able to adapt and therefore gives rise to mismatch disorders, which we call it as lifestyle disorders. And in neurology, some of them are dementia and stroke. We are very familiar with heart attack. It sends a violent signal where a person who suffers from heart attack rushes immediately to the hospital to receive certain life-saving injections which will dissolve the clot in the coronary vessels. Such a concept is truly lacking in stroke. I would therefore try to plead the community at large and the public at large that stroke needs to be visualized as a brain attack, similar to a heart attack. In which case, we have to recognize the acute symptoms of stroke, no doubt, but once you have recognized the acute symptoms of stroke, we don't waste time at all, because it's a brain attack and the person has to immediately reach the hospital for salvageable, hyperacute treatment options that are available world across and in India. Now, if you look at stroke, during the acute phase of stroke, where there is an occlusion of blood supply to a particular part of the brain cells die, and that's how we get a neurological deficit. So it is said that about 2 million neurons die in a minute. That's about 32,000 neurons per second. And therefore time is absolutely crucial, and therefore the slogan, time is brain, brain is time, the golden 1 hour. So if we emphasize a brain attack concept and the patient is rushed immediately into the hospital within minutes, we would be able to give clotbuster therapy or neurointerventional therapy in stroke units by strokologists to save as much as neurons as possible, to substantially reduce the neurological deficit and the mortality and therefore permanent neurological disability. So from that respect, it is very, 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 very important to let the public know that stroke is a brain attack and time is brain, brain is time, because cells are dying every second and we need to rescue the neuronal death by hyperacute treatment that is readily available. Now, how do we recognize stroke is the next issue, and therefore we need to have a voice for stroke as a public stroke campaign. How do we recognize stroke fast enough? Because time is brain, brain is time. And that is by the acronym FAST. Act fast, recognize fast. What does FAST stand for? F stands for facial sagging, or asymmetry of the face, and one side of the face does not move well when compared to the other side of the face. A stands for arm weakness. S stands for speech and language disturbances and difficulty in communication. And obviously T stands for time. Call the emergency ambulance service to come to the nearest hospital to get the appropriate treatment. So that is how we recognize stroke fast enough and reach the hospital fast to get the acute treatment. Now in this context, as I alluded to, 2/3 of Indian population is in the rural and many of them are 30% are below poverty line. Now when you look at this drugs that we use to dissolve blood clots in the brain so that blood flow can be re-established, or trying to put certain stents across blockages so that you revascularize the brain, these are all pretty expensive options and they need to be done by stroke interventional neurologists or stroke neurologists. Now if we look at India, it's a paradox. We have only 1,200 neurologists in India with a population of 1 billion, and most of these neurologists and stroke units and neurointerventional stroke therapies are available only in the urban areas. So how are we going to meet the demand of stroke in India at large, both in the geriatric age group as well as stroke in the young? So I would say that having acute stroke intervention, though very important to prevent neurological disability, is only part of the solution to the larger puzzle of stroke in India at large. But in this respect, I would say that the ISRO, Indian Space Research Organization, have rendered yeoman service through telestroke and telemedicine, where remote hospitals have access to such therapies in India. Now I would like to look at stroke in a different perspective, having spent about 40 years in doctoring and practicing the art and science of modern allopathic medicine. Sometimes I would ask the question whether acute stroke interventions, is it a stent or a stunt? Now the reason for that is I would like to go back to the classroom, in fact. See, fighting illness and combating illness is similar to war politics in medicine. Whereas peacekeeping and trying to promote health and health ease is much more sustainable, economically viable, and a long-term model for a population such as India and other low and middle income countries. So I would like to highlight this preventive concept. I think that needs to percolate to every aspect of the society, right from school children to college students to all other aspects of societal strata. So I'd like to quote Louis Pasteur, who said in 1822, "When meditating over a disease, I never think of finding a remedy for it, but instead a means of preventing it." Yes, definitely you need to fight a disease when the disease starts, but there is always a preemptive preventive measure, which is a rote public health strategy which can prevent stroke. Now it's interesting from a inter-stroke study that about 80% of strokes are actually preventable by 10 to 12 modifiable risk factors. And these modifiable risk factors are nothing but our health attitudes, our eating behavior, our lifestyle, our sedentary behavior, how much of high energy foods we eat, how obese we are, what is our BMI, and so forth. The hypertension, the amount of salt intake, the poor nutrition that we have, the iron deficiency, anemia that we have, all these contributes to the pathogenesis of stroke. So I would say poetically, the shield is nobler than the spear. So you can definitely fight stroke, but I think a larger sustainable model would be looking at preventive neurology. So I would use the word perestroika. We need pluralistic approaches. We need a perestroika between war politics and peacekeeping politics. Let us fight the disease when the disease has started, but in a sustainable manner let us promote peacekeeping and promotion of brain health through healthy brain lifestyle, which can go a long way in a sustainable manner, in a cost economic manner, in a country such as India, for disorders such as stroke and dementia. And I would say that that is the holy grail or a permanent solution for prevention of stroke and dementia at large, that is brain wellness promotion. And that has to be implemented, I would say, from the cradle to the grave, from pediatrics to geriatrics, from school children to geriatrics, at every level of society's strata. This important message needs to percolate. Now, we have what we call as riskometers. How every individual would be able to find out what are their individual risk rates for developing stroke or for developing a coronary artery disease. And the World Stroke Organization has endorsed stroke riskometers, which are freely available as an app in mobiles and various other social media. Now, these kinds of tools or toolkits, which we call it as the stroke risk assessment tool, should be freely available to the community at large, to the population at large, to the children in the school, to the college students, so that they familiarize themselves and they understand that it is their lifestyle that contributes to the ravages of stroke, and how they can use these mobile apps to find out, by filling in the various risk factors, what risk stratification category they are in. Are they in high risk, moderate risk, or low risk? And if they are in high risk, they would be in an advantageous position to self-modify their lifestyle in order to reduce the incidence of stroke in them. So stroke riskometers and mobile apps are very important, and the World Stroke Organization has endorsed that. So what are the lifestyle risk factors for the genesis of stroke, which becomes the foundation for what I call it as the brain healthy lifestyle? For example, hypertension, diabetes, obesity, and physical inactivity. And in India, when compared to the Caucasian West, we have a type of a disease called the Asian phenotype of coronary artery disease and the Asian phenotype of diabetes. We not only have diabetes type 1 and type 2, but we have type 1.5 diabetes, the so-called latent autoimmune diabetes mellitus, and MODY, that is maturity onset diabetes of the young. And we are the diabetic capital and the obesity capital. Other things as far as diet is concerned would be trying to reduce the salt intake to as low as 1.5 grams per day, which had been a Chinese strategy to reduce the incidence of stroke in China. What are the other things that are important? Diet and nutrition are very related to stroke. The consumption of fish to reduce high energy foods, trans fats, too much of cholesterol and fats, to increase the fruits, vegetables, onions, whole grains, brown rice, vegetarian diet. The so-called Mediterranean Asian diet is supposedly very, very important as far as diet and nutrition and stroke is concerned. Leisure physical activity for about 30 minutes per day is said to reduce the incidence of stroke. So exercise is not only for cardiorespiratory fitness. Exercise has a lot to do with brain health and mental health. So in the end, I would like to put an optimistic news. Stroke is definitely treatable and preventable, and as I said, according to the Interstroke study, 80% of stroke are preventable if we recognize and modify the lifestyle risk factors alluded to earlier, which is a good news. And that would be what I call it as the preventive neurology or the brain health lifestyle life course approach, which would be sustainable, viable in the long term, economical, and a very good public health policy strategy model for India as well as low and middle income countries. What would be my slogan for World Stroke Day of October 29th, 2018, well, I would say heart smart is brain smart is mind smart, and prevent stroke by healthy lifestyle choices. I end it with a quote: doing what is right is not the problem. It is knowing what is right. Thank you.